Okay, so this video is going to be all about pregnancy and the associated pains that people get with the abdominal wall, the low back, the pelvis generally, and the pelvic girdle, particularly the symphysis pubis. Obviously, you still get problems with the shoulders, the neck, and the chest, and up into the headaches, but please have a look at some of my other videos because those exercises will remain true across all areas, so that should also help to reduce your headaches and your shoulder pain. So anyway, what we're going to do today is we're going to really look at this bit of you and see if there's anything we can do to relieve any of that sciatic-y type pain that people get, or the pain down here. So without further ado, we'll crack on and hopefully that'll be really useful for you. Right, so this first little exercise is all about the pelvis and trying to really open up how the pelvis moves. I've got my friendly little bit of a model here. Normally I'd show you on a live person, but obviously given social distancing, we can't do that right now. So use your imagination, imagine this flesh and skin on this person. So here's the front of them. Okay, here's the little bony bit here. Here's the spine at the back. This is the little bony bit here, right at the front, where your zip would go. Okay, and then you've got the two knobbly bits here, the white bits here, and they are the two little divots at the back of your back here. Now, in pregnancy, this bit here is about 3 millimeters wide on most people. Now, when you're pregnant and you're giving birth, that goes up to about 15 plus millimeters wide. And so obviously we've got to try and keep that as mobile as possible within reason, but obviously to very defined limits, because that's going to allow that to stretch, and then it's going to make giving birth a lot easier. All the doulas I've worked with so far have found that doing these exercises are really beneficial in the birth story. So hopefully they'll help you too. But if we come to these bits at the back, obviously we have our pelvis moving like this as we walk. As you're giving birth, the baby's head obviously comes through at an angle and it has to push through. What we're going to try and do is get that pelvis just really moving so they can really just slot through quite nicely. And it just should hopefully make it a lot less uncomfortable and reduce the chance of complications. That's certainly experience which suggests that's the case. And it's just a basic exercise. So what we can do is I'll show you how to do it on your own first, and then I'll explain what a partner can do to help increase the efficacy of this motion. I'm going to be trying to show you myself on a bench. It's not so easy, but please use your imagination. I'm sure you'll be able to do it. So what I'm going to do is I'm going to go onto all fours, and I'm going to be pelvis above my knees roughly, and my weight on my hands. If I can't do it like that, I can by all means make fists. It's not a problem. You can see make a fist instead of having your hands like this, whichever is most comfortable for you. If you've got a couple of dumbbells, which are hexagonal, they're not going to roll, you can hold onto the dumbbells, whatever's comfortable for you. Now, the important bit is that as I'm going to be going forward, I'm going to be going back, I'm going side to side, diagonals, and in circles. All of those motions. Now, you can do this for yourself, and when you're doing it on your own, you're likely to go to where you're comfortable. But if you allow a partner to move you, you're going to be pushed to places you don't necessarily want to go. And that's going to be a really beneficial thing, because it's going to open up the whole gamut of motion for your pelvis. So anyway, it's going to be random movements, okay? So you're going to be going forward and back and right over to the side, sitting into that bottom corner here and up into the top corner here. And there is no rhyme or reason. You go where your body feels like it needs to go, okay? And you can sometimes find that you need to stay over there. Even without pregnancy, this is just a really lovely little set of exercises. I can feel this opening up my pelvis, and that's opening through that side of my upper thigh beautifully just by doing this. You know, and I'm doing it a bit quick, trying to show you all the exercises, but if I'm going to give you it's probably more this kind of pace is what I would do with somebody who was actually being treated. If I just turn my bench, you can see it from a different angle. So from head on, you can see what I'm going to be doing is I'm going to be going out to the sides, I'm going to be coming forward and over, back and down, and wiggling all the way around. Cool. Now what you can do is if I get my friend here, this is the equivalent position of where I was just then. The two knobbly bits here, if your partner puts this bit and this bit here, so there and there on their hands, onto those two bits of bone, and as they push you away, you'd rock, 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 and you can do all the circles and everything in between. Now the difficult bit here is trying not to take over. You want your partner to be the one moving you, because that way they will push you into positions that you don't want to go. All right. Now, what I often suggest is that they've got one hand here and the other hand is on your shoulders, because that is really quite a comfort for people. And this one is going to be the guiding. And they can hold you against their own stomach and just help push you around. Now, doing this on the floor is beneficial. They can be on their knees or a kitchen bench seat, anything that's safe, that can take your weight and that you're not going to be falling off. Okay, so look after yourself, have a go with that. I normally suggest you do it about 5 minutes at a time. I've had women many, many times say, don't you dare take your hands off, that's amazing, keep going. So be aware that it can be really helpful. Now, you can do this even while you're in the labour suite. A lot of my clients do, and get the partners to help them with that. It's a really good way just to get that pelvis moving and encourage that dilation all at that same time. But given the fact that you may have just already given birth, this is also really helpful just to try and get everything back into the right positions, so that as you begin to tighten back up, that everything's being tightened up where it should be instead of where it's got to in the birth story. Anyway, have a go with that. It's one of the most favourite exercises that my clients have for pregnancy. Hope it really helps you. Okay, so one of the other videos I'm going to show you today is all about that sciatic type pain that people get going down their leg. It's quite common in pregnancy, sadly, and there's not many things you can do to get rid of it. And you'll hear every disaster story out there going, oh, I've had it for 20 years, it's never gone away, la la la. But actually, that's not necessarily true. I find huge numbers of people get almost completely over it in no time at all. And it's normally done with using a ball. Okay, hard rubber, hard cork. It doesn't make any difference what it is. 60 millimeters, 70 millimeters, 80 millimeters. I wouldn't go bigger than 80, but I tend to stick to the 70s if it was me. I'll try and show you with that and see what you can do with it. Now, obviously, I'm going to show you in this position as though it's my left leg that's got the problem. What I'm going to do is I'm going to be sitting up like this, and I'm going to roll my body weight away. I'm going to put the ball just there. Okay. What I'm going to do is put my hands back on the floor. I'm going to put my body weight on it. Now, that's absolutely fine. I'm sitting on that fine, but that's because all the weight is on my arms and on my legs. I'm really not sitting on that ball. But what I can do is I can let the weight in my arms go, and I can just be doing this. Now, obviously, when you're pregnant, you might have your legs a little bit further out. Okay, and you've also got increased weight, so you will be taking more weight in your arms. Okay, and you just wander around here, and you'll find a couple little spots that go, now that's lively. That's going down my leg. It's going down to my foot. It's just really uncomfortable. As long as it's not like electricity type pain, doing this is very beneficial. And all you do is you say, okay, so that's a 6 out of 10. Let's just wait till it becomes a 3. Keep finding it. Keep having little moves around. Okay. Now, if you're not finding very much in that position, okay, keep the ball there, cross your legs over like this, and come back into this position. Now, in this position, you'll be getting in much, much more deeply, and you might find something different. Okay. But you might find it easily on the first one as well. So have a go with that one with your legs bent, and also this one with your legs just out in front of you, just taking your body weight. Do both buttocks, do it for about 30 to 40 seconds, not for ages, wait till each point disappears, and repeat it several times a day. So long as it doesn't feel bruised, if it's just painful but not bruised, that's absolutely fine. Have a go with that. Hard rubber ball, hard cork ball. I think I got this one off the eBay auction site. I think it was like £2. But the best place to get them from is a pet shop. So there's loads of pet shops open at the moment. The one a couple of doors up from me here in Bournemouth is open, selling dog food and stuff like that. But they also happen to have the dog balls. So get in, get yourself a dog ball, a couple of quid, worth every penny. Okay, so there's one little bit that happens with pregnancy. Not that often, but it does happen. And that's a lot of discomfort in the outside of the hips here and over the sides of the hips here. Now that's often because you're lying on your side in bed trying to protect the baby and protect yourself. Okay, and that's great, you've got to do that, but it can lead to a lot of compression through here. So one thing you can do is get an old single duvet, put it underneath your sheet, and then sleep on that. That just takes a bit of the pressure of the mattress off you and it gives you a bit more support. But if you're not getting any relief from that, then please go back to the buttock exercise we've just shown you, but come right out of the ball, not right on the edge, but come out, not right on the bone, but come out a little bit further, and sometimes that can be beneficial for getting rid of some of the lateral thigh pain. But the other one is just literally just to get you've got your bony bit here at the front of your pelvis, just work down there about an inch, inch and a half down, about half an inch out, and just have a little poke around in there. And sometimes you can find, oh, that's nasty. But sometimes you can find some really good little points in there which are quite uncomfortable. It's called the tensor fasciae lata, the TFL. Do have a look on Google or any other search engine. I'm sure you'll find a picture of where it is. Just get into there and you can find some really good little trigger points in there, and that can really relieve some of that lateral thigh pain. That might really help you. Okay, so the last thing I'm going to try and show you here for pregnancy is all about symphysis pubis. Now you hear a lot about symphysis pubis dysfunction. I treat a lot of it in my clinic, and it's quite effectively treated by working at the bottom of the end of the rectus abdominis muscle. That's these two ones here. So your quintessential six-pack muscles, the ones which come right down to the bottom here from the bottom of the ribs. Obviously you've got your transverse, you've got your obliques that go diagonally and that way as well. but we're working at the rectus abdominis, which is the two go here. Now, if you get your core working well in the very, very early stages of pregnancy, I found that it can be quite effective in trying to help prevent that rectus diastasis, which is where you get the little hernia runs down the middle here with the two bits split apart. Not a very common thing that you do see it, but actually if you can get your whole abdominal wall, all four sections of the muscle working properly, I've seen a decrease in those hernias, and I've also seen a lot of people not even develop them in the first place when they've had them in a previous pregnancy. So that's really, really great. So get a little bit of core control in, that can be very, very beneficial. Anyway, for the right down at the bottom here pain, this is where you sometimes sadly see people in wheelchairs or with crutches if it gets really, really bad. But what you can do is you can get right into the bottom of the bone there. Now if I just try and sit back, if I just bring my hand down my stomach here, then I get to the bone there. So now I'm on the bones quite low down, okay? Now I'd be doing this sitting in a chair or something like that, but I'm trying to do it on the floor to make it easy for you to see. And all I'm going to do is I'm going to use my thumb tip and I'm going to come down. So I'm going to push onto the top of that bone. I'm going to start right in the middle here, on the top of the bone, and I'm going to push down against it. Now, when you've got symphysis pubis dysfunction, this is exquisitely painful. Okay, I will warn you that right now. The vast majority of my patients will cry when I do this muscle. Okay, I'm not asking you to push and try and bury your thumb through your pelvis. I'm just asking you to squash that muscle against that pelvic brim bone. So if I put this person here and I was trying to do it, what I'd be doing is I'd be coming down the stomach wall, down, 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 and getting my thumb onto the top of this bone just here. And just pushing, starting in the middle, working my way out towards the edge here. Okay. Now if you just do that on both sides, so I'd then sit on this side, I'd do the same with this thumb, try and show you with my thumb, pushing down onto the bone. Just do it on both sides. Just literally for a few seconds each side. If you can tolerate it, wait till the pain subsides on each point before you move to the next. I find there's an average about 5 or 6 points on each side, and that's very, very, very effective. Hopefully that will get you straight through that first bit. Good luck. I forgot one little bit I was going to show you, and that's for people who are breastfeeding after giving birth. I see a lot of people get pain in around the scaphoid, and now that's a lot of the time because they're holding the baby's head in an awkward position, or they're supporting the baby when they're bathing, all that kind of stuff, and there's a lot of tension in your forearm. Please have a look at my forearm tension video, that will be really beneficial for you, but you can't necessarily get rid of all of it. Now, it's really important that what you can do is you put your thumb in like this, and you like that, and you tap in there. Have a look at the snuff box tap test. It's really important that if you've got a fracture in there, you get it seen really urgently. But it's a very, very, very uncommon fracture, so just be aware that if you've got pain in this area here, there's that little dip in, you can see it there, that little dip just there. If you tap in there and it's very, very painful, that's not a good thing to have, so you want to go and get that checked. It'll almost certainly come back negative, but it's better to have it definitely come back negative than to leave it and have a problem further down the line. But one thing I know you can do is, again, I can use some rock tape. You'll have heard me talk about this on other videos. It's just kinesio tape, but rock tape for me is by far and away the best stuff there is out on the market. All I'm going to do is I'm going to take a bit, that's about 10 inches long, fold it in half, and then round off the ends. And this is where I'm going to get all a bit origami on you. I'm going to split it down the middle for about 3 inches. And again, just going to round off those two corners. Should have been on Blue Peter really. Now this is where it gets a little funky. So what I'm going to do is I'm going to tear the tape there. You can see I've just torn it. Okay, and then here where the other leg is, I'm just going to tear it there as well. So the two little legs are now dangling and free. That's remarkable little person. And then again, I'm going to fold those two bits of tape, those bits of paper over on the back there so that I've got access to them. Then all I'm going to do is I'm going to hold it on my forearm here. I'm going to undo one of those legs of tape, and I'm going to take it through the web of my thumb there. I'm going to stick it onto my palm there. So it's like that. Now I'm going to do the same with, well, the opposite with the other side. You can do this on your own. It's easier if you've got a partner to help you. And I'm going to bring it round here, like that, and I'm going to cross over. So they're both stuck to skin, but you can see they're crossed over. Then what I'm going to do is I'm going to take the tape at the back, I'm going to peel off that backing, stretch it, leaving about 2 inches of paper attached. I'm just going to pull it down my forearm like this, just tack it down, pull that paper off, finish sticking it down, and there. And that little V going either side of your thumb is a little bit like a thumb spin, but because it pulls over this bit here, it's really useful, just giving a bit more space in there. It can be very, very supportive for that bit. So have a go with that as well. Just a little bit of rock tape, you can get it online all over the place. I would honestly, I think it's the stickiest stuff there is. If you're quite greasy on your hands, then you might want to get the H2O version of it, which is a bit more sticky. Now, obviously, you can get this wet. If you rub it, it's just going to peel off when you're getting out of the shower. But if you pat it dry, it should last for a little while. This bit, if you find it's coming loose, then just put a big ring around your thumb and hold it on, or put a bit of zinc oxide tape or something a bit more sticky just to hold the ends down there, and it'll still give you the support. But have a go with that, I'm sure it'll be really beneficial. Okay, so that's us done for pregnancy today. Hopefully some of those exercises will be really beneficial for you and will get you out of pain and discomfort and help you on your way down to have a really great birth story. One of the really important things with pregnancy is you don't feel alone. Please always use online services, use video conferencing, use the phone, chat to people. Don't feel you're doing this on your own, because there's always going to be people around who can be of benefit to you. The medical services are there to help you as well if you need it, or even just doulaing and having some support from a doula over the phone. Please go for that and help yourself by not being alone. And on the other side, when you have given birth, if you're going to breastfeed, that's absolutely fantastic, and I take my hat off to you straight away for doing that. But again, don't feel alone. If you struggle with breastfeeding, don't just feel you have to give up because it's all about you. Because my experience tells me, working in this job where I treat enormous numbers of children with breastfeeding problems, that actually most of the time it's the child's got an issue with their jaw. It's a very simple fix, and I'm sure I might be able to cover some of that stuff in a future video. But please don't feel alone. Talk to people. Don't just feel you have to give up and make yourself feel bad about it. It's often nothing to do with it. In fact, in my years of doing this, I've never found a problem with a mother yet. So don't give up on yourself. Be positive for yourself. Be strong. You are doing an amazing job. Just having a baby and then feeding that baby is just incredible. Even if you decide to go to formula, you are still amazing. Well done. Okay, so that's today's video over. Hopefully it's been useful for you and you can take away some of those bits and use them in your daily life. Please, please, please subscribe at the bottom of the page. The more subscribers I get, the more quickly I can get this out to the wider world, and hopefully more people can get help. Also, please share it on Facebook, use the information, talk to your friends about it. I don't care what you do, just get this information out there, get the nation healthy and help people to get better really quickly. So go on, have fun with this,